Good morning, guys. I hope we're all sparkly. Today we're going to tackle a very important question. Is TRT safe? Yes, no, or maybe. Is TRT dangerous? Yes, no, or maybe. Now, disappointingly, the answer to this question is not as clear-cut as we would love it to be. So, healthy male androgen levels. The answer should be pretty simple. Healthy. So, the premise of TRT is to mimic natural physiology. The most effective way of doing that is daily microdosing of testosterone cypionate and HCG. Hormone replacement therapy, not testosterone replacement therapy. So if you have achieved optimal levels, how can TRT be dangerous or unsafe? We're going to discuss a case study today. Now, my guys are regularly followed up, both clinical review and blood work to measure quantitative parameters to make sure the testosterone has not negatively impacted on other biological markers. The situation is rather complex. So let's go. Let's do a deep delve. Guy, mid-50s, ex-competitive bodybuilder, always struggled with his hematocrit. He's had healthy levels, feels great, gets a bit sluggish when his hematocrit rises up. Now, the knee-jerk reaction is stop TRT. What you should do is look at other factors like blood pressure, because it's the combination of blood pressure and a rise in hematocrit that increases cardiovascular risk. Look at other markers like his lipid profile. So as we know, LDL takes cholesterol to the cells, HDL takes cholesterol away from the cells. So you want a nice ratio of that to minimize cardiovascular risk. You want to normalize estradiol, because whilst estradiol helps maintain the endothelial lining of the blood vessel, too much causes blood pressure. Because what is it all about? Balance. So look to the other cardiovascular risk factors and then make an informed decision as to whether there is an issue. Then look to causation. So this guy, bad snorer, he's had a sleep study and he's now on CPAP. He was referred to a hematologist. Hemochromatosis was excluded, so he's good to go. So with a rise in hematocrit, normalizing the causation should hopefully lower that back down to a normal level. But it hasn't. Damn. What else could be going on? Well, he's an ex-smoker, so COPD obviously affects the gas transfer of oxygen into the lungs. So guys tend to have a slightly lower O2 saturation compared to healthy people. So there's a corresponding rise in erythrocytosis to compensate. So you create more red blood cells to carry more oxygen to the tissues. Now, we've spoken about this before. Red blood cells are a physical thing in a fixed volume of water or plasma. Now, obviously, you can physiologically adapt to some degree, but there is a capacity that is unfortunately met. Thick blood, heart has to pump harder. Clearly, that leads to increased cardiac demand and load and increase in blood pressure and obviously cardiovascular risk. So you must take everything into consideration. So, ex-smoker. So are his lungs still compromised? Well, he vapes, and he vapes a lot. So it stands to reason that the causative agent is vaping, causing a respiratory problem. So we've suggested that he goes to the GP to have tests for COPD to hopefully reverse his low oxygen saturations and subsequent rise in hematocrit as a result. But disappointingly, his hemoglobin was above 200. His hematocrit was above 0.6. His blood pressure was elevated. So as much as I say healthy melandrin levels are healthy, they are, you have to have a considered opinion and make informed decisions about the best care possible. And in this case, disappointingly, even with cracking levels, we have had to suggest that he comes off testosterone replacement therapy for a period of 6 weeks to look to causation, to donate, to reassess his hematocrit, and hopefully restart TRT in the near future. So you'll see the question, is TRT safe, is more complex than you would originally think. Now we look at brain, we look at estrogen as being neuroprotective, but we know that excess estradiol compared to testosterone and DHT causes an element of anxiety, and guys get a little bit emotional. I always know if my E2 is creeping up if I cry at Johnny Cash's Hurt. It's a very emotional song, I'll have you know. And then you get told DHT is neurotoxic. Well, let's not be retarded. Let's understand this concept of balance. Guys have more testosterone, more drive and determination. DHT, a little bit of aggression. Estradiol, more empathy and understanding. Then compare that to females. More estrogen, more empathy and understanding, less aggression, less drive and determination. Sorry, Lydia. But our bodies survive on this premise of balance, baby. Not too much, not too little, just right. So microdosing, mimicking physiology, should have you golden, should have you moving forwards. But you do need to have a holistic approach to care. Whilst you may have healthy melandrin levels, guess what the medical profession is going to say caused your heart attack, caused your XYZ? It's going to be the testosterone replacement therapy, because males were under attack. There's a fundamental lack of understanding and awareness within the medical community about the importance of testosterone in overall health. Unfortunately, there is an ignorance and arrogance through this patriarchal healthcare system that we are involved in. This will not change with numpties doing YouTube videos stating TRT does not cause cardiovascular disease. Now, you first have to have an appreciation of how to critically read and analyze a study before spouting about it. Because even a robust study is not fact. You cannot apply one study, no matter how good it is, and then say this is 100% fact. All studies have limitations, bias, confounding factors. It's super important to not take a study and say, well, this study said this, so I can now do this. You need to speak to an actual health professional who understands physiology, understands this need for a holistic approach to patient care. By all means, get dialed in, but understand this.